Get your knee pain under control using these top 7 expert recommended natural home knee pain remedies. In this video, I'll be covering all 7 natural remedies. And just a bit about me, my name is Dr. David Midoff and I'm a specialist physical therapist at Paso Manual Physical Therapy. This channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and medications. Please subscribe to the channel so that you don't miss out on any of the helpful videos that we upload every single week. Let's get to these natural remedies. Number 1, tailgate swings. This is a hidden gem and this is huge. So I'm sitting here on the edge of this table, my feet are dangling. You may not be able to see my feet, but all I'm doing is just swinging my legs back and forth. At home, find a computer chair or a bar stool or somewhere where you can sit where your feet dangle off the ground, and all you gotta do is wiggle back and forth. This is huge to make sure that fluid inside the knee joint moves around so that it can nourish the cartilage, the meniscus, and all the other tissues inside the ligaments. This does tons of good for recovering from knee cartilage problems, knee meniscus problems, and getting swelling to go down. Doing this for 5 to 10 minutes at a time, several times a day, every 2 to 3 hours or more often if you can, really can help control knee swelling as well as pain so that you can sleep better at night and get back to being a bit more active throughout the day. Now, speaking of sleep, the next tip that I highly recommend is finding the best sleep position for your knees. Oftentimes people get much discomfort with finding the best sleeping position at night. They can't have their legs straight or bent, or lying on their side hurts their knees or their hips. Let me show you what you should be doing. If you go to your bed and grab a pillow, lying on your side is ideal. Not everybody can do it. I'll show you how to lie on your back with knee pain, but getting a pillow under your knees and making sure that your knees are comfortably bent. Not bent a lot, not straight either, but bent just a comfortable level. And you might need to play with the position as best as possible, but getting your thighs parallel to each other rather than with your knees together so that your thighs make more of a triangle shape. You want them to be parallel to where you got some space between your knees, because if you have your legs together, then you put some stress and tension on these muscles right here. But as soon as you do that right there, a thicker pillow works better. Then you can take some of the stress and tension off and alleviate the irritation at the knee joint while you sleep at night. Now, what you need to know about this is you might still get irritation on your knee joint. It might still hurt and wake you up at night, but it should reduce the amount of discomfort that you're getting, and it should allow you to get a little better sleep. Fixing the root problem is a key thing to make sure that your sleeping gets better, but this will allow you to get a few extra hours of sleep with more comfort. If you can't lie on your side, then you want to get your knees in a bed position on your back. So just getting a pillow under your knees is a big deal so that you're not completely flat, because that tends to increase pressures inside the knee joint, which irritates cartilage, meniscus tissues, and other things inside the knees. But as soon as you put something under the back of your thighs, close to your knees, under your calves, not only is it much more comfortable, but you'll be able to tolerate sleeping better at night because of this pillow behind your knees. The third natural remedy that I highly recommend is using a foam roller or some cylinder like this that's padded but firm to release your quad muscles, the front of your thighs. Often with knee problems, these muscles on the front of your thighs all the way up into the hip area can get very short and tight. They can be tender. They might have knots in them as well. And rolling them out is of huge benefit. You can roll it out with your hands just like this if it's really sensitive, or if you want a little bit more aggressive pressure into your thigh muscles, which is fine as long as you can tolerate it. And what you want to do is lie face down on one of these things and roll on it like so. And you could just hang out here for a minute or two, rolling different positions to get different angles of your muscles, all the way up into your hip area like this. This doesn't need to be done for very long. I would do this multiple times a day as well, especially if you have very tight muscles in your quads. A minute or two per muscle. So if you're talking about all the different muscles in your thigh, you shouldn't need to spend more than 5 minutes on your one thigh that's bothering you. Of course, you can do your other side. That'll add more time, but you get diminishing returns the more you use this. I'll put a link in the description for purchasing one of these. There's a huge market for these. There's some that vibrate, that have a device in the middle, and they buzz while you're rolling on it. A simple one like this I think is most effective. You can always get a fancier one if you like. They're all kind of the same in my opinion, unless you have your personal preference for a nicer one. The fourth tip that I recommend is strengthening your glute muscles. I'm going to link another video in the description that's got 5 glute muscle exercises that you need to be doing if you've got knee pain. But just to give you the brief synopsis of why you need to be strengthening your glutes, is because your knee problem is almost always coming from the hip, because the hip joint is a ball and socket joint, and not only can the hip move up and back like this, and it can come inside and outside, but it can also rotate. And rotation is one of the biggest problems, and the glute muscles, the butt muscles, greatly control the amount of rotation that happens, which means that at the knee joint, if you're not strong in your glute muscles, you're gonna tend to rotate inwards, and that's what causes increased pressures at the knee. I can go into all the details, and if you want to check out our channel and find more videos about it, we've got tons of it. But what I can tell you right now is it's a key, very important thing, very key thing to be strengthening your glute muscles if you've got a knee problem. The number 5 remedy that I recommend is strengthening your calves. Second only to strengthening your glutes, the calf muscles are, of course, on the back of the lower leg behind the knee joint, and they do attach the knee into the knee joints and influence the knee joint. Not all the muscles go up into the knee joint area, but some are below the leg. And because of their influence on the foot position, the ankle, those forces can be transmitted up into the knee joints. And if you don't have good strength in your calf muscles, you bet your knee is not going to operate correctly. So you've got to be doing some calf exercises. And just like I did with the glute exercises, I've linked another video that we've got about calf muscle exercises that you could be doing to strengthen your knee joint. Just check it out in the description here below. Number 6 for helping your knees naturally is using your toes when walking. Now this is a weird one for everybody, but when done right, it tremendously helps knee problems. I've got a video in the description linked here below that talks about exactly how to use your toes during walking. But the gist of it is, every time you step, your toes should be grabbing a bit with every single step that you take. And this can be done inside your shoes. You can practice it barefoot. There's a bunch of different ways to do it. This video will take you step by step on how to do it. Go check it out so that you can begin to use your toes properly to support your knee joints and reduce those bad pressures and save it from becoming a worse situation like arthritis or a meniscus tear. Tip number 7 is using a brace for specific knee problems. I've got a video also describing when you should use a brace and when you shouldn't, and what types of braces are appropriate for certain conditions. That's also linked here in the description below. But if you've got the right problem, which happens quite a bit, using a specific type of brace, which you can find out exactly which ones I'm talking about in these videos, will help your knee problem out tremendously. If you use a brace for a certain amount of time, it will allow certain tissues to heal, like a meniscus or a ligament problem, so that you can get better mobility without having to have surgery, without having to rely on injections or pain medications. But you've got to have a structured plan for using the brace. And it's not a good idea to be using the brace indefinitely, without some goal in mind for the brace. Because if you do that, muscles can get weaker over time and you'll actually become very dependent on the brace. But if you go into using the brace with a plan like we discussed in our videos, you'll be able to eventually wean yourself off the brace and resolve your knee problem for the long term. So that covers the 7 natural tips to solve a knee problem. I'm going to give you a bonus one that I'm of course biased towards, being a specialist physical therapist myself. I highly recommend going through specialty physical therapy. What I mean by specialty physical therapy is most PT clinics know what to do for people that have had surgery. So if you've had a knee replacement or a meniscectomy, or like they've done an arthroscopic procedure for your knee where they've gone in with the cameras and made little holes in your knee, most PT clinics can handle that type of care afterwards very well. They're designed to run you through exercise machines and a circuit, and you can work with assistants, and you'll do pretty good in typical PT clinics. But if you've never had a surgery, then seeing a specialist, especially like a manual therapist like myself, is ideal for resolving your knee problem naturally without having to eventually have a surgery or rely on injections or pain medications. If you're looking to set up an appointment with a specialist physical therapist in your area and you're wanting to know if they help out people like I'm talking about without surgery, then all you've got to do is call the clinic up, maybe visit them and ask if they've got any specialty training for people that have not had surgery and are looking to never have surgery. I can tell you specifically, manual therapy training is probably the number one thing that you're looking for. So you're going to be looking for somebody who's got manual therapy certifications or fellowship or residency training. Now, if you happen to be in an area where you just don't have access to that, the next best thing that I recommend is something that we can offer you. It's our 28-day knee health and wellness boost program. You can find out more details about it down here in the description below. What this is, it's a 28-day program, 100% online and on demand, where I take you through specific exercises, coaching and instruction on how to improve your overall knee health. Now, I'm not saying that it's going to take 28 days to completely cure your problem. That might just be starting it up and getting the momentum. You might have to go 2, 3, 4, 5 months depending on how severe your injury is. But you just pay once and you get access to this program, and you can repeat it as many times as needed. And we've got amazing reviews from it. People are telling us that they're actually avoiding surgery. They felt better than ever before. Some people are now able to lunge and squat, whereas they never dreamed of being able to do that in the past. And some people don't want to lunge and squat. That's fine too. You don't have to lunge and squat to do the program. In the videos of the program, we show you how to modify the exercises and change them so that if there's something that you can't do, you can avoid doing it, or you can make it easier for yourself as well. You can learn more about this program by just checking out that link in the description below for the 28-day knee health and wellness boost program. I hope this video was helpful for you. If you thought it was, give us a thumbs up, and don't forget to subscribe so that you don't miss out on any of the helpful videos that we put out every single week. Have a wonderful day, guys. Bye-bye.